Hi, my name is Andrew Barrows, and this is my Term 2 validation video for the Foley catheter. I started off by providing privacy to the patient, and I'm introducing myself, and identifying the patient using two identifiers. I'm asking if the patient has any latex or iodine allergies, and making sure I have all my supplies and equipment available. Start by performing hand hygiene. And placing regular latex gloves on. Positioning the patient. Since he's a male, I'm doing supine with his legs extended. Removing the latex gloves. And performing hand hygiene again. And placing a chuck at the foot of the bed for any garbage or trash. At this point, I'm opening my sterile package. Being sure to start by opening the flap away from me. Then the sides. And finally the last flap towards me. Adjusting, only using my 1-inch border. At this point, I'm going to don my sterile gloves. Starting off with my right hand, make sure to touch only the inside of the glove. Get my fingers up into the glove. And then go to my left hand, making sure to only touch that inner flap. Being careful not to touch the glove with my skin at any point. At this point, I'm just setting up my sterile field in a good working condition for me. Normally I'd be sure not to shake the box on my sterile field in real life. Just placing a drape underneath the patient, being sure not to make contact with the patient's legs with my sterile gloves. And then placing the fenestrated drape over the penis. At this point, I'm taking all the materials I'm going to be using, including the lubricant. Placing it over the tip of the Foley catheter. Attaching the syringe. Placing the swabs in the package. Now my left hand is going to become clean. So normally I'd make sure to clean the meatus of the penis with all 6 swabs. The video I only used 3 swabs, but normally I'd use all 6. Trying to get the tip of the catheter off the penis, off the lubricant. And I'm being careful with the catheter and inserting it into the penis very gently. Going down all the way to the bifurcation. And I'd be inserting the balloon here. Placing slight tension to make sure the balloon's in place. At this point, I'm discarding all the materials that are removed and contaminated. Right? Securing the catheter to the patient. Ripping the fenestrated drape off. And I'd normally hang the foley below the level of the bladder to confirm the tube is not kinked, and indicate the time and the catheter insertion on the label. And wash my hands. At this point, I am removing the catheter, getting the order, gathering the supplies I'll need, identifying the patient and explaining the procedure to him. I've washed my hands, donning clean gloves, unsecuring the foley from the patient. Deflating the balloon. And I'm gently removing the catheter from the patient. Disposing of the trash or removing it. Covering the patient up, returning him to a normal, comfortable position and restoring his privacy. And I normally just throw this away, but for school purposes, I might have to reuse it. And covering the patient up. Raising the head of the bed. Lowering the bed to the lowest position to make sure the patient is safe. Removing my latex gloves, my contaminated gloves. And finally, washing my hands.